WCEG Network. We are the worldwide community empowerment group where we speak life into the community and we speak life into you. Log onto WCEGTalkRadio.com. Watch us live on your smart TV, on the Roku, cable channel, YouTube, Facebook, and LinkedIn. I'm Dr. Cassandra Wanzo, host of Mind Matters for the next hour. Subscribe free to our YouTube channel, WCEG Network. Like us on Facebook and Instagram. Connect with us on LinkedIn, TikTok, and Threads. Download our free WCEG mobile apps. Alexa, play WCEG Talk Radio. Listen to WCEG on any of our 12 podcast distribution platforms. Last but not least, the topics and opinions are those of the show host and guest and not WCEG Network. Thank you for your continued support. Good evening again, and welcome to Mind Matters, where we discuss relevant mental health issues. I'm your host, Dr. Cassandra Wanzo. I'm a psychiatrist, and I've been practicing in Atlanta for the past 30 years. Our co-host this evening is Miss Shavett Athouris. She is a registered nurse and has been a registered nurse for over 20 years. She has served as RN case manager at various hospitals and clinics, provided psychiatric rehabilitation, treatment and assertive community treatment teams, and has worked as the director of nursing for well-known agencies. She was a nursing professor for 5 years at a university in Atlanta, Georgia. She is the marketing director with Surge 365 Travel Company. She's the administrative director for a nonprofit where they help develop and mentor youth. You can visit the website at www.theosmovement.org. Welcome, Shavett.
Thank you for having me.
So our topic this evening is the heart-mind connection. Again, the heart-mind connection. February is American Heart Health Month. It's a time to raise awareness about heart health and heart disease. Heart disease is the leading cause of death in the country for men and women. I want to give a shout out to my beautiful sisters of PTO, that Psi Tau Omega chapter of Alpha Kappa Alpha, as we raise awareness about heart health in our Pink Goes Red campaign. Heart disease is more prevalent in African Americans, and that's due to a combination of factors, including high blood pressure, obesity, diabetes, and the social determinants of health, such as poor access to health care, limited access to healthy food, and higher stress levels associated with systemic racism. What is the heart-mind connection? Mental health and heart health are intertwined. Our mental health affects our heart health. Our heart health affects our mental health. Again, our mental health affects our heart health. Our heart health affects our mental health. Prolonged stress wears on the heart and makes us more vulnerable to heart attacks and strokes. Stress jolts the body's immune system defenses and releases inflammatory proteins that kill off healthy cells and damage cell growth. Let me repeat that. Stress jolts the body's immune system defenses, releasing inflammatory proteins that kill off healthy cells and damage cell growth. That in turn pumps up cortisol and adrenaline, which are fight or flight hormones. These fight or flight hormones raise blood pressure, they raise blood sugar, and they raise the heart rate. After a severe cardiac episode, such as a stroke or heart attack, it's natural for us to worry. You might feel sad, exhausted, frustrated, or overwhelmed, especially if you're in pain, if you're disabled, or you struggle to sleep. About half of all heart failure patients show signs of a clinical depression. These feelings can escalate into a major depression or anxiety, which further affects the functioning of the heart. Over time, that raises the likelihood of another emergency or death. When someone is depressed, the depression saps the heart patients of their energy, it saps them of their motivation to take care of themselves. That results in more missed appointments and more missed medication doses. Depression is also linked to unhealthy habits such as smoking, eating less nutritious meals, and skipping workouts. They feed into each other. It's a vicious cycle. Mental health conditions dramatically drive up the risk of cardiovascular illness. It drives up the risk of related complications, and it drives up the risk of death, and vice versa. Over a third of people who've had a heart attack experience a clinical depression, and over 40% of heart disease patients also have an anxiety disorder. So some topics that we'll also discuss this evening are: what does a heart attack really feel like? What are differences in heart attack symptoms in women? When to call 911 for a heart attack? And most importantly, we are going to cover proactive steps that we can take to promote overall heart health. So that's what we'll be doing this evening. So I'm going to start off with, what does it really feel like to have a heart attack? People most often report chest pressure or tightness. Imagine the feeling of someone sitting in your chest. That's close to the sensation brought on by a heart attack. It can feel very oppressive. Heartburn-like discomfort. It's quite common for heart attacks to feel like acid reflux. In fact, the symptoms can be nearly identical. Shortness of breath. Some heart attacks don't cause pain at all. These are called silent heart attacks, and these are most common in people with diabetes and older adults, the silent heart attacks, characterized by shortness of breath. Some people report pain on the left side. Signs of a heart attack could include pain radiating up to the left side of your jaw or down your left arm. Sometimes people complain of a backache. Fatigue. This symptom is most common in older people and can be misdiagnosed as a flu-like illness, fatigue. Nausea and sweating. While these symptoms can come with heavy chest pain, they can occur by themselves, especially in women. Nausea and sweating can often be the only signs that a woman is experiencing a heart attack, nausea and sweating, so pay attention to that. Can symptoms differ between men and women? Yes. For the most part, men and women experience similar heart attack symptoms, but 1/3 of women experience different symptoms from men. Women are more likely to experience shortness of breath, fatigue, and insomnia starting before the heart attack. They can also experience lightheadedness and dizziness, pain in the back. That's a common key symptom, pain in the back. Pain in the back, shoulders, neck, arms, abdomen, and jaw. Extreme weakness, anxiety, nausea, and vomiting. Women are less likely to experience the chest pain in the center of their chest. So women are less likely to experience that. That's more of a symptom that men to experience. What a heart attack doesn't feel like. So what I'm reading now, these are symptoms that you have. They're not a heart attack. Momentary symptoms lasting only a few seconds because heart attack pains last longer. If it feels like a pricking sensation, if it's just a small, well-localized area of your chest, if it gets better or worse with breathing or positional changes, if it can be reproduced when you press on your chest or move your arm, those are more likely musculoskeletal pains. If it radiates below your abdomen into your legs, can heart attacks go unnoticed? Yes. Some people only learn that they had a heart attack following a medical checkup that takes place weeks or even months after the cardiac event. How could someone not know they're having a heart attack, you ask? Well, not all heart attacks are equal when it comes to bringing pain. Mild heart attacks can bring symptoms that mimic indigestion or general tiredness, feelings that might not set off alarms in your head. Plus, there's also the factor that no one really wants to believe that they're having a heart attack. People often ignore their symptoms. Denial is real when it comes to heart attacks. You want to just wish it away. Oh, no, I'm not having a heart attack. It's just indigestion. I mean, like I said, nobody wants to believe that they could be going through a heart attack. In order to diagnose if you've had a heart attack, you have to have an EKG, and then there's certain blood tests that they can do to diagnose the heart attack. Certain enzymes go up, like called troponins and kinase levels. When should you call 911? Given the sometimes subtle symptoms, it can be hard to know what is a heart attack and what's not. The best rule, if there's any sense that what's happening could be a heart attack, seek help immediately. Any heart attack, even a minor one, can damage your heart muscle. Early treatment can minimize that damage. Every minute truly counts with a heart attack. If you feel like something's wrong, please get seen. Don't ignore. Don't ignore chest pressure. Don't ignore shortness of breath. Don't ignore nausea that lasts for more than 10 minutes and seems to be getting worse. Listen to your body. Again, listen to your body. So in general, call 911 if the symptoms occur suddenly and last for more than 10 minutes. If you're experiencing shortness of breath and or chest discomfort while you're at rest. If you develop symptoms and are middle age or older with risk factors such as past or present smoking, diabetes, or family history of heart disease. Younger women who smoke or have diabetes, hypertension, or ovarian dysfunction also are more vulnerable. Why is it important to call 911 for an ambulance? The reason is about 1 in 300 people having heart attack symptoms end up developing a life-threatening arrhythmia on the way to the hospital. If it happens in the ambulance, then treatment can begin immediately. So I wonder, did you have any reactions before we go to the proactive part, Shavett?
Oh, I mean, what you're sharing is key information, especially, it definitely can be a silent killer.
Mhm,
And oftentimes people will say, oh, I feel a little chest pain or,
mhm,
a little tightness or even in your back, and you take Tylenol or Motrin and
mhm,
lay down and think it's going to go away.
mhm.
But you just have to listen to your body. It will talk to you
Yeah,
in subtle ways, but you just have to be keen on your body.
absolutely, absolutely. So I don't know if we have any questions or messages from the audience at all yet. Um, okay, so what proactive steps can we take to promote overall heart health? And Ms. Shavett is going to answer that.
Yes, well, there are several things that you can do. Um, I know with heart disease and different things related to your heart, sometimes it can be as simple as a family history that it's in your family history that you are prone to having heart disease, and other times it's just our diet, the stress that we're under, and things of that nature. But there's several things that you can do to help promote your health and improve your blood pressure and things of that nature, things that can really help with the heart, so to speak. So I'm going to give you a couple of those, and one is controlling your blood pressure. First off, if you are have high blood pressure or diagnosed with hypertension, you want to make sure that you take those medications daily and consistently, and that will help, you know, stabilize that heart where when the blood runs through it, the pressure is where it needs to be. Definitely want to do that and monitor it regularly. If you don't have a blood pressure cuff at home and you do have hypertension, I would highly recommend going and getting a blood pressure cuff that you can check it at home and even keep a log, because you want it somewhere. Optimal is really around 120 over 70 or maybe 120 over 80 is like an average blood pressure. Medium is 140 over 80 and high is 160 over 90. So I would just definitely recommend getting one of those if you don't have one. And you can also increase your potassium level by eating bananas, spinach, potatoes, different types of beans. They can also help balance your sodium level out, which tends to increase that blood pressure as well. And then I know with the times we live in, oh my goodness, that
Mhm,
we can be under so much stress right now. We That's like a whole nother topic, right?
mhm,
But managing your stress,
mhm,
and you can do that by doing deep breathing exercises, meditation, yoga, lots of different things that can help to lower that stress level. But you've got to find a happy place. Got to find a way to get those stress levels down, and those things will help as far as managing stress. So that's one, controlling your blood pressure. A second one is controlling your cholesterol levels. That's another way. Having a healthy diet that's not so high in saturated fats and trans fats, that will really help. Eating things like avocados, olive oil versus vegetable oil, and some of the other oils that are out there. Olive oil is like one of the best ones that you can actually use when cooking. And then eating different nuts and things like that. And then also increasing your fiber intake. You can do that by eating things like oats and barley and legumes, and that will lower your bad cholesterol, which they call LDL, but that will help to lower the bad cholesterol. And another one is incorporating omega-3 fatty acids. And you can get that from different fish like salmon, mackerel. Even flax seeds have omega-3 fatty acids as well, and walnuts. And all of those can help lower your triglycerides, which can also help reduce inflammation that you might have in your body also. And a third one is exercise, exercising regularly. Now, what they say is about 150 minutes of moderate exercise each week. So that's roughly 2 hours a week, maybe 2.5 hours a week. And that's things like a brisk walk or cycling or swimming. But if you're going to do something like a vigorous, intense exercise, then you can do 75 minutes if a week if you're going to be doing like running or some type of aerobic class. Those are more intense and vigorous. So you can do 75 minutes a week if you're doing that. And then also, um, you can include some type of strengthening training exercises. You can do that like twice a week, and that's going to help build muscle. And that will also help improve your cardiovascular health, your heart health as well. So, a fourth one is eating a heart healthy diet. So, what is a heart healthy diet? That's where you eat more fruits, vegetables, whole grains, lean proteins like chicken and fish and legumes. Those will all help to eat like a heart healthy diet, so to speak. And when you're thinking about vegetables, think of it this way: the greener, the darker the vegetable, the more healthier it is for you. The lighter the vegetable, then it may not be as healthy for you. But if you're thinking of dark, like greens, asparagus, spinach, different things that are very dark and green are much healthier as far as a vegetable is concerned. Limiting processed foods. And I know in today's world, there's so many things out there that are processed. We're on the go. We want to get that fast food, but those fast foods are processed and they're not as healthy for you. And also things that are high in sugars and high in fats and sodium, have a lot of sodium in them. So you want to reduce those processed foods because they have all of those different things in them. And then staying hydrated. Now, this is one I know some people say, oh, I don't like water, but drinking plenty of water will help. Also, with like sugary beverages, you want to limit sugary beverages and instead try to drink more water. One thing you can do, I know Crystal Light makes a little powder that can go into your water. They sell them in all the grocery stores, and that can flavor the water. That can help you to drink water more if you're someone that doesn't really like to drink water. Now, this I'm going to give you is such a plus. It is something that's been a blessing to us, and it's something called the Yuka app, and it's spelled Yuka. Yuka app. So let me explain to you what this is. You can go to your Google store, the Apple store or the Google Play Store and download it, YUKA. But this app is amazing because what it does, it helps you to choose healthier choices. When you're in the stores and your grocery stores, and you're trying to figure out what food you want to buy. What cosmetics do I purchase? What deodorants and lotions are good for me? What's products are good for my body versus not good for my body? This app will do it for you. All you need to do is once you download it, you set it up, and it's from there you just scan the barcode of different items, and it's going to tell you if it's a good, it's going to rate it out of 100. So it's going to tell you if it's a good product or if it's not a good product. And if it's not, then it's going to actually tell you in writing on the app for that product what ingredients are within it that are not healthy. Are there cancer causing ingredients? Are there ingredients that may cause diabetes or even may cause depression? The app is absolutely amazing. So we have been able to, I've scanned deodorants and it said, nah, not this one. I've scanned the lotion. It was like 0 out of 100. I've used this lotion for years, probably since I was a teenager, and the same deodorant. So, but this is going to help to really, really get you in a healthier place, get healthier choices as relates to the products that you use and you currently buy. So I would definitely recommend downloading that Yuka app. And the fifth one is quit smoking. Now, Dr. Wanzo, did you have anything so far? Because I have maybe two or three more of these to go through.
Well, one thing that you were telling me that I like is that the Yuka app gives you alternatives. If your
Yes,
product
it
is not good,
does.
it gives you alternatives.
Yes.
Um, right. Oh, the only thing I'm gonna add about the LDL and HDL, a little bit about that. Like, the LDL, which stands for low density lipoprotein, is what we call the bad protein, bad cholesterol, because the LDL is the cholesterol that accumulates in your artery, it forms plaque and blocks the blood flow. So you want the LDL to be less than 100. The bad cholesterol, you want it to be less than 100. The HDL, which is the high density lipoprotein cholesterol, is good because it removes cholesterol from the bloodstream and transports it to the liver for removal. And they're reduced with it's associated with reduced risk of heart disease. So you want the HDL levels to be, they said, for men above 40, for women above 50, but ideally above 60 for everybody. And the overall cholesterol should be under 200.
Right. Good, good. Thank you so much for that. So I will give you one or two more. Another one, fifth one is to decrease or stop smoking. If you are someone who smokes, then you want to definitely consider maybe a nicotine replacement, like a patch or a gum that you can chew. You can ask your primary doctor about those products, but that's something that can help you to decrease and stop smoking, which would definitely help as it relates to your heart and heart disease or what puts you at risk. Um, and also, you want to focus on other benefits like reminding yourself that if you were to stop smoking, it tremendously lowers your blood pressure and also improves your circulation throughout your body. And in turn, definitely helps to reduce your risk of different cancers, different heart disease, and lung disease. Another one is I'm getting plenty of sleep. I know we have such busy lives. And even myself, I'm bad about this one also because it's like I have so much to do and I wake up early and I go to bed late. So this is one that I'm also working on. But you want to just basically establish some type of routine for yourself each and every day. And one culprit for many of us not being able to go to sleep is our phones or electronics. And one thing that you may not realize is that once you're not on your phone or your computer, it takes the brain about 1.5 to 2 hours to shut down from all the activity of being on your phone or being on your computer. So when it's time to go to bed, if you want to go to bed at 10 o'clock, then you want to get off your phone or computer at least by 8 o'clock and give that brain time to shut down from all the lights and it's called the it's like a blue light is what they call it from the phone and the computer that keeps that brain awake. So shut it off at least 2 hours before you want to go to bed, and that will help you to go to fall asleep around the time that you really want to fall asleep. And then another one is limiting your alcohol consumption. So if you drink, it says limit alcohol to no more than one drink per day for women and two drinks per day for men. If you do drink alcohol, and you can also stick to other alternatives, something like maybe a lighter alcoholic drink, or something that may be non-alcoholic as well. But overall, all of these things with managing stress, lowering your blood pressure, exercise, all the things that we just mentioned are things that can really help to get that heart where it needs to be. And Dr. Wanzo, some people don't understand that's not in the medical field, how the heart um, connects to blood pressure. So I like to tell my patients this way. Imagine a water hose. When a water hose is straight, the water flows very nicely out of the end of the hose. If there's a kink in the water hose, at the end, it just kind of splurts out. It doesn't really flow like you want it to, right? That's how it really is with the blood that flows through the heart. If there's plaque in the arteries, it's going to block, it's going to be like that water hose. It's going to block the flow of that blood going through the heart because the blood goes in on one side of the heart and goes out on the other side, where it's cleansed and all of that. So if the pressure is off,
Mhm.
that means that your blood pressure is elevated, you get a headache, and if the pressure gets too high,
Mhm.
that's how you can have those heart attacks
Mhm.
because of that. So you do want to make sure that we're controlling the blood pressure, limiting the sodium, doing some of the little things with the exercise that we talked about, because all of these combined play a big role and a factor in keeping that heart healthy.
Awesome. Awesome. So I just want to share maybe some of the things that I do. One of the things that's very important for me is taking a break, taking vacations. Definitely that's something that I do to try to, deal with the stress is taking a break, taking a vacation. You've got to do that. You've got to have me time. Um,
Mm-hmm.
Something else that I do is massage. I schedule like a standing massage, monthly. So that's really helpful. I remember when I used to work in the jail system, it was so stressful. I had a standing appointment every week for a massage because it was so stressful. But I end up leaving that environment because it was so stressful and toxic that I left. So it's important to be able to identify what your stressors are and then be able to, try to manage it because if you can, continue to have yourself in that toxic situation, right, you're making yourself more likely, to have a heart attack. Find hobbies that you enjoy, whether it's reading, gardening, things like that. I find it's important to express gratitude, things that you're thankful for. Um, Laughter, like going to comedy shows. I like to go to comedy shows or watch funny movies or listening to calming music like Luther. That's why when they had that special, I really loved it because he's one of my favorite artists, Luther Sade. So some things that help volunteering, helping others, that helps you to feel good. And building your connections, your social support, friendships, that's key because a lot of us in this society suffer from loneliness, but connections help us emotionally and help to build up our feel good, hormones. So, oh, like we've covered everything. I don't know if there are any comments or questions from the listening audience.
So while we're waiting for comments, Dr. Wanzo, I'll add if you're someone who
Mhm.
likes massages, but you don't really like the price of maybe $100 each massage, then you can go to a massage school.
Mhm.
And that's something that I used to do is go to massage schools, and I think I paid maybe $20 or $25 per massage for 1 hour. Because even though they're students and they're learning, their
Mhm.
instructor is there, and it may not be the same as someone who's experienced and been doing it 20 years, but you
Mhm.
still get that nice 1 hour massage where you're relaxed and it can be a little bit more cost effective for you. So I just wanted to kind of add that in case someone is thinking of massages and don't maybe can't afford the $100 per massage.
So
Yeah.
for $20 from the massage schools, you're saying?
Yeah, that's what I was used to paying.
Oh,
Now what it may have been increased, but it's a lot less expensive by going to a massage school and
oh,
getting it done,
okay.
and having a massage.
Okay. Oh, something I forgot to mention. Um, People want to know, can grief kill you? Actually, there is a real syndrome called, because you hear like someone died and the next day their spouse might die. That can happen. It's called broken heart syndrome. And there's like a long name for it. So earlier we talked about the fight or flight hormones. So if you experience an emotionally traumatic event, like the death of a spouse or a child, something that's just, extremely overwhelming, the fight or flight hormones can flood your system and cause your heart muscles to stop contracting normally, putting your heart in heart failure. Um, the symptoms of broken heart syndrome can feel like a heart attack, and they can include sudden and severe chest pain, shortness of breath, irregular heartbeat, low blood pressure, fainting. Even on the EKG, it can look like you're having a heart attack because in EKG, there's certain chains called ST elevations when you're having a heart attack, and you can have that with this syndrome. It can imitate a heart attack. Broken heart syndrome is probably caused by the increase of the fight or flight hormones, the cortisol and the adrenaline, while heart attacks are usually caused by a blood clot in the arteries, like she was talking about, like a kink, the plaque in the arteries. Most of the time, the heart failure will resolve, but it can cause death in some instances. The rate is very low, but it can cause death. Um, and that's called your broken heart syndrome. The most common precipitant for it is grief. Um, but other emotional stressors that can be associated with broken heart syndrome can be positive experiences. Like if someone wins a multi-million dollar lottery, that can also cause that overwhelming flow of of the stress hormones. So winning the lottery, the death of a loved one, surviving violence, or surviving a natural disaster, those can often bring on broken heart syndrome, and the broken heart syndrome can show up within minutes or hours of any highly charged emotional event. So it's called broken heart. And so you can die from grief. I mean, it's not that common, but it can happen. So that's just something to know about.
Yeah. You hear about that, and you wonder if it's really true. And
Mhm.
that's amazing how it actually is.
Yeah, it's called broken heart syndrome. But like I said, it's
Hmm.
got a long medical term that I can barely pronounce. Yeah, it does exist. So, um, like I said, for the most part, heart attacks are caused by clots in the blood system. But in women, you can have heart attacks that are caused by um, spasms of the artery. So, so instead of a blockage, sometimes in women you can have a heart attack that's caused by spasms in the artery. So,
Hmm.
but for the most part, right, they're caused by blockages and the things you mentioned as far as dietary, exercise, smoking doubles the risk of heart attack. So that's one major thing that you can do to, promote heart health.
Hmm. Hmm.
Oh, I don't know.
And Dr. Wanzo, I would definitely, like you were saying earlier, is making sure that you do self-care, and whatever things you can actually get a piece of paper and write down all the things that you are stressed about. Maybe you're fearful about some things, but you can actually write those things down and start getting rid of things that are stressors in your life.
Mhm. Yeah.
Because we all have things that we can be stressed about with the
Right.
times that we're living in, from so many different areas in our lives. But just think about what those things are and which ones that you can control, that
Right.
you can get rid of.
Right. Because a lot of people who've gotten letters from the government and things they don't know if their life and job is in jeopardy and that's gonna uproot their whole lives. I mean, that's very stressful. That's very
Yes.
stressful.
Right. Right.
But I think one thing, another thing that I rely on is prayer.
Absolutely.
Yeah, I rely on prayer.
Absolutely. That's a
Hmm.
big one. Yeah. Prayer always, as they say, can
Hmm.
change things.
Hmm.
And I want to give a couple of statistics and information on the stop smoking, because that's one of the areas that doubles your increase for heart disease. I
Mhm.
want you to listen to these numbers. So it says 20 minutes after quitting smoking, your heart rate and your blood pressure decrease. It drops. A few days after quitting smoking, the carbon monoxide level in your blood drops to normal. 2 weeks to 3 months after quitting, your circulation improves and your lung function increases. And that's just 2 weeks to 3 months. 1 to 12 months after quitting, the coughing and the shortness of breath decreases. 1 to 2 years after quitting smoking, your risk of heart attack drops dramatically. And that's 1 to 2 years after stopping smoking.
Wow.
5 to 10 years after stopping smoking, your risk of cancers of the mouth, throat, and your voice box, which is like called your larynx, is cut in half. And your stroke risk is also decreased. That's 5 to 10 years. And 10 years after quitting smoking, your risk for lung cancer is about half that of a person who is still smoking. And your risk of cancers of the bladder, esophagus, and kidney.
Oh, I think it froze.
So those are
Yeah,
those are.
I know it froze. If you could repeat the last few sentences, it just froze for a bit. So
Oh, did it? Okay. Did you hear the 10-year and the 15-year?
we'll start with the 10-year and the 10-year.
Okay, it says 10 years after quitting smoking, your risk of lung cancer is about half that of a person who is still smoking. And your risk for cancer of the bladder, esophagus, and kidney decreases dramatically. And the last one is 15 years after quitting smoking. Your risk of heart disease is close to that of a non-smoker.
Wow, that's dramatic.
That's
Wow.
really dramatic,
Mm.
really dramatic. So I just wanted to share those numbers and that the information. So those of you that are considering or on the fence, there are so many benefits as to
Mm.
that will help you if you were to decrease and eventually stop smoking.
Okay. Oh, something
Mhm.
else I want to mention that's important in terms of reducing stress is mindfulness, which means living in the moment, not worrying about the past or reliving the past, or not worrying about the future, but living in the moment. It's important to be able to practice mindfulness, and there are different places that you can go to learn about it because it involves breathing and other exercises. But the main thing is learning to live in the moment, mindfulness.
Yes, absolutely. So maybe there's someone out there that may have a question or comments.
Also want to ask, what are the tests that determine if you have a heart attack? So the key thing would be the EKG is the main thing, but then there are blood tests like a troponin level that if it's elevated, then it shows there's death of a heart tissue. So the troponin levels and the EKG would be the main studies to determine if you've had a heart attack.
Mm-hmm. And if the EKG um,
Mhm.
came back that had signs of various things that shows up, then typically your primary doctor would refer you to a cardiologist which is a heart doctor, and that's where they can do even more in-depth tests as well.
Like more in-depth tests would include like an echocardiogram. It's
Mm-hmm.
like an ultrasound of the heart, and that can show the heart while it's actually beating, and if there are any changes in the blood flow or the ejection fraction, which is the amount of blood that the heart pumps out, because that can be reduced in a heart attack.
Mm-hmm. Absolutely.
Okay. Any other questions? Okay, well, so
No
thank,
other questions out there, comments?
let's see, anybody looking? Okay, so I want to thank our co-hosts for participating. Hope that this has been very helpful. So the bottom line, if you feel like something is going on with your body, don't wait. Go get help. Call 911.
Mhm.
Don't like try to drive yourself, because I said you can have an arrhythmia on the way and die from the arrhythmia. So yeah, don't take yourself, and don't take your spouse or whatever, because they'll be, probably, just as,
Yeah.
scared as you. So it's important to call 911 so the ambulance can come. So if you need to give you oxygen or something to reverse the arrhythmia, then, that's very important.
Mhm.
So I
And then
guess,
I would highly recommend too, you know, it's so important to go to your primary doctor at least once a year, minimal, at least every 12 months. You could think about it on your birthday because you want to have more birthdays to come. Maybe during that month is the month that you go to, you say, I have to go to my primary doctor. And that's where one of the things that they do on every annual visit is lab work. And like Dr. Wanzo is sharing with you, the troponin level. There's so many different things that lab works can show, from infections in your body to your organs, from your heart, your kidney, your lungs, your liver. There's so many different things that it can tell. Um, they even do prostate checking for prostate issues now through blood testing. So if you're someone out there who even does not have insurance, I was talking with someone the other day, and they don't have insurance, but then they said to go to a primary doctor's visit was like $150. It's like, well, if you're only paying that once a year, that's worth it. That your health is worth it.
So I guess the thing with the troponin level, what it happens is when the heart, because when you have a heart attack, a certain portion of the heart muscle is damaged. So what the troponin level does, it shows that there's damage to heart muscle, and if that's elevated, then that's from the death of the muscle cells. So that's what elevated troponin levels show for heart damage. So that's a very important test. So any other questions? Like I said, I hope that you've been educated, and, hope that this has been very helpful for Heart Health Month. And again, I want to salute the women of PTO, Psi Tau Omega of Alpha Kappa Alpha for your efforts in, promoting heart health. And the bottom line, heart health is mental health, and mental health is heart health. And also, if you are having symptoms that interfere with your ability to function in terms of depression or thoughts of wanting to harm yourself, please do not hesitate to get help. And if you feel, like you are wanting to do something to hurt yourself, the crisis line is 988. 988 is the suicide crisis line. So again, heart health is mental health, and mental health is heart health. And with that, I want to wish you all a great evening, and thank you for listening